Welcome to the Pregnyl RX Medication Administration video series. My name is Hannah. I'm a nurse at VFP Pharmacy, a Pregnyl RX pharmacy partner. In this video, we'll review mixing and injecting Pregnyl HCG. The room temperature medication. It should be injected shortly after reconstitution, but it can be stored in the refrigerator for up to 30 days. You're going to have to flip off the caps from both vials and alcohol wipe both. You should have a 3 ml syringe, generally with a 22 gauge 1.5 inch needle. Make sure the needle is twisted on tightly. Remove the cap. Pull the plunger back to the amount of liquid that you're instructed to remove, usually 1 ml. Put the needle through the rubber stopper of the water vial. Inject that air in. Flip the vial over and pull back to the 1 ml mark. You'll then inject that 1 ml of water or diluent into the vial with the Pregnyl powder medication. It will dissolve instantly. There's very little powder in the Pregnyl vial. Swirl it around gently, don't shake. Make sure to tip it upside down and right side up so you get all the powder. This one is a little bit challenging to draw up. You need to flip the vial upside down. There's a very small amount of water in this vial, so you'll need to pull the needle almost all the way down so that the very tip of the needle stays in the liquid while you're pulling down on the plunger. At this time, you'll cap the needle and replace that with a new 22 gauge 1.5 inch needle for injection, for an intramuscular injection. Tap the needle, press on the plunger until you see a droplet form at the tip. You're now ready for your intramuscular injection. Okay, lean over. You're going to put your pressure on the non-injection side leg. Okay. Wiggle your toes on the side that you're getting the injection. Okay, that'll allow you to keep the muscles in the backside loose. This injection is done in the upper outer quadrant of the buttock area. Find your landmarks from the top of the hip bone and drop your thumb back and give a squeeze, or you can spread the skin taut. For her, I'm going to squeeze, alcohol wipe the area. Let it dry. And a quick dart-like motion. And gently pull back on the plunger to check for any blood return. And gently press. You go straight out. And have an alcohol wipe handy if any blood is seen. The sharps container comes with a permanently sealable top. Open the lid. You don't have to recap the needle, just drop the needle and syringe into the sharps container. You can close the lid, but do not seal it until it's full. If you have any further questions regarding your medications or protocols, please call your doctor's office or the pharmacy where you received your medications.